All right, so let us continue the Nash therapeutics study streak for 25th April 2025. And last few sessions we have discussed the gastric remedies, L-Socotrina, Croton Tig, and Natrum Sulf. So, hello, Dr. Kushal, Dr. Uh, Instash Ishmit, and Dr. Charanya, Dr. someone named as Homeopathy Approach, and few others on YouTube. We are learning different remedies in a series mentioned as it is by Dr. Nash in his book Nash Therapeutics, Leaders in Nash Therapeutics, Leaders in Homeopathic Therapeutics by Nash. So that's the title. But due to the frequent use of the author name, it becomes like that: Nash Therapeutics, Nash Therapeutics. Anyways, so let's continue with Natrum muriaticum, the remedy today. And this is a very long remedy in Nash Therapeutics, Leaders in Homeopathic Therapeutics by Dr. Nash. And there is a lot of detail he has given about not only this remedy but other remedies also. So I have thought to take it up in two parts. So today we'll cover the first part, which is the first 3 or 4 pages. And all those who are new to join, because I see some new faces in the Instagram live, I want that before referring any authors or any new authors rather, have you read the old and the you know contemporary authors, classical authors? You should refer those, master their not the knowledge from their books, and then come to new authors. If you'll keep on reading the new authors, you will be biased, you'll be prejudiced, and you will get stuck up in that loop of learning from or referring those books only which are latest available. So that's why last year we took up Ellen's keynotes study streak. Every day some complementary remedy to the previous remedy related to the remedy which are ongoing. Weekly we covered 6 to 8 remedies, 10 remedies, and now we have now taken up Nash therapeutics after finishing Allen's keynotes. So for Natrum muriaticum, Dr. Nash writes in his book, in the beginning, it's a very beautiful book because the way he narrates the case, it feels as if you're sitting next to him in his clinic and he's narrating the case. The case, the materia medica, the philosophy, the potency, the repetition, everything. So this is a small book, underestimated by many homeopaths, but very valuable if you want that confidence in your clinic. He begins with writing a small commentary in 2 pages about how sulfur and natramure have been abused in crude forms by people and allopathic doctors, and they take in large doses but they doesn't cause any benefit to them. But the same two medicines, sulfur and natramure, given in potency, transforms the body into something extraordinary. And next thing, what Dr. Nash tells us is that the allopathic doctors tell you that low potency, they will not believe; high potency, they will not believe in homeopathy because the substance is too minuscule in the medicine bottle. But the same allopath will fear a small microbe which is 0.0005 millimeter in size. Quite surprising. So that's where he tells us that let them do whatever they want to do. Let us practice the best. He opens up the first two pages by giving us this confidence that whoever says whatever, we need to keep our work going on. Natramir is one of the best remedies for anemia. No matter the cause, loss of fluids like in China or Kalika, menstrual irregularities like in pulsatilla, loss of semen which is in phosphoric acid or China, or grief or other mental diseases which are the reasons for anemia or are a part of the disease picture in anemia case. Natramur is bound to work in all the cases. Anemia of natrum, Dr. Nash describes in few beautiful and commonly seen observable phenomena: paleness, nutrition, patient eats well also, कितना खाती है but वजन बढ़ता नहीं है, throbbing headache, shortness of breath, aggravated by climbing stairs, scanty menses, constipation, depression of spirits. Everything similar to pulsatilla. The only difference being consolation aggravates in natramur or aversion, and pulsatilla has amelioration from consolation. Then he says that there is fluttering, palpitation, intermittent action of the heart, and high potency usually helps in such cases. He mentions a case of a patient who lost around 18 kgs of weight, 40 lbs, and within 3 months, natramur helped him gain the weight. All the homeopaths who are giving tonics, alfalfa tonic, avena sativa, etc., etc., if you're tired, give natramur 6 potency, 12 potency, or 30 potency twice a day. For 2 months, you will see the difference in the patient. For chronic headaches, Dr. Nash writes that natramur chronic headache comes in paroxysms every few hours or maybe at certain time only, and it will be intense and throbbing in nature. When patient tells us that it's throbbing, we think of belladonna. But anemia in such a case will decide in favor of natramur. Think also about melillotus, belladonna, nux vomica. If the face is red, eyes are burning, eyes are injected, and pain is beating and throbbing. After every menstrual period, if the patient has headache, think of natramur. Schoolgirls headache, Dr. Nash has mostly given natramur and the other remedy is calcarea phos. And surprisingly, both the remedies have anemia. And he has found a bit of confusion between two remedies to prescribe because they look very similar in such presentations. So he has given one. If he has failed, he has given the other. He has succeeded. That should not be the rule book. You can maybe try to individualize and find out what are the peculiar symptoms of the patient and prescribe. For eye strain and headaches from eye strain, natramir is one of the top remedies. So also is argentum nitricum and ruta. And next he goes on further from the head to the lips and the mouth and the face, and he tells us that the lips and the corners of the mouth in natramir are dry, ulcerated, cracked. Same we also see in Kondurango and nitric acid. And then he also gives another comparison down the line between intim crude, natrum, and graphitis. For graphitis, it is eczematous and eruptive character of eruption with the corners of the lips which are, cracked, and that's where he differentiates natramur with graphitis. Next is natramur for dryness of the mouth. If it is without actual dryness, then and there is a bit of a dryness which is subjective to the patient. This is very important. In such cases, natramur works well, and we have to differentiate mercury in such cases. Pulsatilla also has dry mouth, but it has no thirst. Natramur has bitter taste and also loss of taste. And there is a vague sensation on hair. I have never encountered any patient telling this, but it's of use when natramur, silica, and kali bichromicum are, the three remedies which are there in this particular symptom. Now, there are some beautiful observations that you can do if you are seeing the patient in your clinic, and based upon observations, you will be giving a lot of remedies. Let us see. There is a patient who comes to you, narrates the entire case, you are confused what to do, what to give, you have examined, you find nothing. Clinical examination for the allopath is different, for the homeopath is different. Once you understand that, your job to prescribe and analyze the cases becomes easier. Deep, painful fissure in the middle lip is always natremure. You will find this in guiding symptoms of hearing, and you will get this confirmed from different patients again and again. If the upper lip is thick, swollen, think of natremure, belladonna, and calcarea carb. The swollenness is nothing like an erysipelatous or inflammation, but it is just a kind of a thickness. And if the gums are scorbutic, think of carbovage, murk, and muriatic acid. Going further, he goes in the gastric passage and tells us that natremure is one of the only remedies which has, or perhaps few remedies amongst the few remedies that has numbness and tingling of the tongue, lips, and the nose. We see that there is a kind of a tingling and numbness in single parts in aconite, but here it is there in the tongue, lips, and the nose. That's where you should think of natremure to prescribe. Chronic soreness of the liver and digestion. In such a case there was also numbness and tingling of the tongue, lips, and nose. Natremure CM potency was given by Dr. Nash. The case improved drastically. In cases of MAP tongue, think of natremure, arsenic album, lacasis, nitric acid, taraxacum. Natrum is not such a great throat remedy, so you will not find it frequently prescribed in recurrent, pharyngitis and tonsillitis or laryngitis. But Dr. Nash has given in certain cases of follicular pharyngitis which were abused by nitrate of silver. Nitrate of silver was frequently used at that time to apply locally and also prescribed internally. Now it is too less, but if patient comes with lot of allopathic medication taken, especially if it is having some components of silver or mercury, think of natremure very strongly. Next is salivation, which is profuse, watery, and salty. Whenever you give a remedy to the patient, and after 2 weeks he comes and tells you, or 1 week he comes and tells you that after you gave the medicine, my taste changed and now my taste is salty. This is nothing but the secondary action of natremure. Again, the patient will eat so much food that even though after eating he has not put on any weight, and he still continues to eat well. Natramure will work along with acetic acid, abrotanum, iodum, sanicula, tuberculinum. Natramure patient also feels sleepy and weary after eating, but the same iodum patient which has the same hunger will feel better. In fact, he'll feel better in this process of eating. After eating, there are a lot of symptoms in natramine. One of them is also the aching and the heaviness and the sense of fullness and discomfort in the region of stomach and the liver. So natramure may probably avoid eating, or he will tell you that I'm fine after certain mouthfuls. But iodine will keep on going eating all the time. In fact, the process of eating itself is so medicinal or therapeutic for iodine that they will tell you the glow in their eyes when they talk about it. Better by eating is there in many remedies along with natramure: anacardium, chelidonium, petroleum, iodine. And there are some remedies which are hungry remedies as per Dr. Nash. Lyco and China are a couple of those remedies. For anacardium, Dr. Nash tells us that there is pain in the stomach which extends to the spine. And there is all gone sensation. Khali khali lagta hai. There is an emptiness feeling. Better by eating. After 2 hours, he must eat again. This is there in anacardium. But in cheridonium, you will see there is hunger plus liver symptoms. And China, Natamir, and Lyco, patient will always feel full after eating. There will be flatulence, distress after few hours. But iodine patient will keep on eating every few minutes, every few moments. So that's what takes us to the end of today's session. And follow Homeo Setu on Instagram, YouTube, Facebook, and WhatsApp channel. And we'll connect soon with the second part of Natramure, the next 4 or 5 pages. It's a really long remedy, very essential in our day to day practice, shouldn't be missed. So stay tuned.